Welcome. Each year a recertification process is required for you to continue administering medications to those you support. This course will provide information to help maintain your skill and knowledge for safe and effective medication administration. Upon completing this course, you will be able to understand the importance of medications and the proper procedures and regulations for administering medications. Describe the 8 rights of medication administration and how to store and dispose medications correctly. Apply knowledge for safe and effective medication administration and techniques that promote a pleasant and stress-free experience.
Did you know that 7 out of 10 doctor visits involve some type of prescription medication? In the United States, over 125,000 people die each year due to failure to take their medication correctly. That's 60% of people cannot identify, by name, their own medications. Over $100 billion is spent on prescription medication each year. That nearly 1/2 of people who take medications ignore the directions on the labels. And lastly, the average person with disabilities may have as many as 6 to 10 medications prescribed. Accurate medication administration is critical for safe and effective use of any medication. It is our responsibility to ensure each person supported is administered medications, as ordered and directed, at all times.
The Board of Nursing defines the term medication administration to be any level of support or supervision provided to ensure a person supported receives his or her medications as prescribed. As illustrated on the slide, there are 6 parts of this medication cycle. The medication cycle is a series of steps or actions that defines the management of medication in the treatment of health conditions. You are a key player in the medication cycle and have a role in each step. During this course we will review the cycle and provide information regarding your role and responsibility for each step. The steps include observation, reporting changes, healthcare visits, storing and disposing medications, and medication administration documentation. Let's begin with the first objective, understanding the importance of medications.
Medications are a very significant part of managing our health. They can cure and treat diseases, relieve symptoms caused by a variety of health conditions, and help to improve our quality of life.
Medications are powerful chemicals which, if not used properly, can lead to new health issues, injury, or even death. No one shall administer medications or assist with medications without training and competency determination. The 8 rights of safe medication administration must be followed each time medication is administered to each person. The 8 rights of medication administration include giving the right medication at the right time, to the right person with the right dose and right route, providing the right documentation and administering the medication for the right reason, and lastly provide the right education to the person regarding their medications.
As support staff, your personal values or beliefs must not interfere with the prescribed treatment for those you support. Advocating for a person includes observing and reporting any change in a person's physical or mental health to medical professionals. Our role is to promote independence, which includes being involved in the medication administration process.
Prior to administering medications, you must 1. Review each person's care plan for medication administration instruction. 2. Review doctor orders. 3. Get organized. 4. Wash your hands. 5. Review the medication administration record. And 6. Always administer medication to one person at a time. This section of the course reviews how to prevent medication errors along with what to do in the event of a medication error. Did you know that most human errors happen as a result of a distraction? Therefore, you should always administer medications in quiet areas free from noise, interruptions, and commotion, which can be very distracting. To avoid medication administration errors, follow the prompts provided. Always follow the 8 rights of medication administration. Be patient. Do not rush through medication administration. Avoid all distractions and be focused on the person and the task. Stay with the person until the medication has been fully taken. Prepare medications for one person at a time. Never hide your errors or cover for someone else's. There are two types of medication errors that must be reported. 1. Documentation errors and 2. Medication administration errors. Documentation errors occur when the medication has been given, but some type of documentation is incorrect on the MAR. Examples include not providing your initial after administering the medication, using the incorrect color of ink, discontinuing a medication early, or signing for a medication that was not needed. The second type of errors are medication errors. They consist of failing to give a medication when ordered, giving the wrong medication, and administering a medication that has already been given and causes being over-medicated. All medication errors must be reported to the home manager immediately. If the medication error involves overdose, the person's physician must be notified, and if physician recommends, an emergency room visit must occur immediately. Review the medication error flow chart, which is based on the type of medication error. Through observation, we can be observant to changes in the person's actions or behavior, which may help detect medical issues. It is important for you to know each person you support. By knowing each person well, you are more able to notice any changes in their actions, routines, appearance, and behavior. Explore any changes by asking the person questions or asking those who know the person best. Report any information related to change or what is discovered by asking questions to your supervisor or nurse. Lastly, always follow medical recommendations as outlined in the person's care plan. Look for symptoms that are objective. Objective symptoms are those that can be clearly identified using our sense of sight, hearing, touch, and smell. Examples may include seeing a rash, hearing a cough, hot to touch, or smelling an odor. Symptoms that are subjective consist of those that can only be experienced by the person and may not be objectively identified. This might include pain, dizziness, soreness, stiff, or blurred vision. When being observant, pay attention to body and facial expressions, such as the person holding a specific area of their body or squinting at bright lights. Observe for any changes in a person's typical behavior or actions. What do you notice is different or unusual about the way the person is acting? Are they sleeping more or less, talking excessively, irritable or easily agitated, or not eating or wanting to eat more? Report any changes to your supervisor or nurse. Any changes or symptoms that are observed must be reported as soon as possible. Reporting objective and subjective symptoms is important and must be done both verbally and in writing. Verbally report any symptoms or changes to the home manager and the nurse. This allows the information to be relayed to the appropriate medical professional. Follow up by documenting the symptoms as a critical incident in the critical incident log. In the event the symptoms rise to the level of a life-threatening emergency, you must call 911. The next section of the medication administration cycle is visiting the healthcare practitioner. During a physician's visit, be sure to provide accurate information that is based on facts and not opinions. Be specific when providing information. For example, Johnny's aggressive behavior has increased 25% during this month, rather than Johnny is always upset. Be an advocate for the person and their well-being. Prepare the person for the visit and discuss your role based on the support the person wants and needs. Encourage the person to participate in their exam. An example to support a person to be actively engaged in the exam may include, "Johnny, why don't you tell the doctor what you told me last night about how you are feeling?" If the person does not want to speak up, ask for permission to share the information with the physician. Always be prepared for the physician's visit. Be knowledgeable of the reason for the visit. If you are not told, please ask. Provide relevant medical information based on the request from the physician. Have the information organized in a concise method. Be sure to have available a list of current medications and allergies. Share any changes or updates since the last visit, as applicable. Best practice for successful medical follow-up is to ensure you have everything you need prior to leaving the physician's office. Do not leave the physician's office until you have the original and a copy of the prescription, the completed physician's visit medical consultation form, the signed discharge papers, if leaving the hospital, and lastly, make sure you have the next appointment date and time, if applicable, and communicate the information to the nurse and home manager upon your return. Medication storage goes hand in hand with safe medication administration. We will be reviewing the safe medication storage requirements during this section. All medications are to be kept locked. A key is available to staff which allows access, and for required accountability checks, controlled medications must be kept in a locked, keyed, storage box for each medication separated in a Ziploc bag. All medications are to be stored in a central location, where there is no severe temperature or moisture changes.
Oral medications can be stored in the same locked cabinet. All medications must remain in the original container, as dispensed by the licensed pharmacist, with labels intact. Prescription medications are to be kept in separate, Ziploc bags within the storage area. There should be no more than a 1-month supply of any prescription, including PRN medication, available. If refrigeration is required, the medication must be stored in a locked box within the refrigerator.
There are times when a medication is no longer needed or has expired. Safe medication disposal is necessary and must be followed. Medications which are outdated, mishandled, or no longer in use must be disposed of safely and securely. Upon disposing medications, it has to be witnessed and documented. Documentation must be noted on the back of the MAR. The documentation must include date, time, name, dosage and reason for disposal. 2 full signatures are required, one by the person disposing the medication, and the other by the witness. When medications are left behind after a person's death, your supervisor must be contacted for specific instructions. When a medication needs to be disposed of, the first step is to contact your home manager and inform them of the situation and why disposal of the medication is needed. Step 2 includes putting the medication in a Ziploc bag with wet coffee grounds. The final step is to dispose the medication, with a witness, in the outside garbage.
The next section of the medication administration cycle addresses documentation required upon administering medication.
MAR is an acronym for Medication Administration Record. The MAR is a record that verifies medications are administered, as prescribed by the physician, and administered by a trained and competent unlicensed personnel or licensed personnel, such as RN or LPN.
The MAR contains regulated required information. You must follow Premier Support's policies and procedures for all medication administration documentation.
Always document immediately after administering each medication. Do not attempt to complete other tasks while administering or documenting. Follow the 8 rights of medication administration. Never leave a MAR blank. If you make a mistake, you must notify your home manager and circle the mistake in red ink. PRN medications can be over-the-counter or prescription medications. PRN medications and over-the-counter medications cannot be administered for more than 3 days in a row. If more than 3 days is needed, an emergency room visit is required. Use the same MAR to document PRN medications. You must include on the back of the MAR, 1. What was administered. 2. Why it was given. 3. What time it was given. Provide the same information in the critical log and verbally communicate it to the next shift staff that the PRN medication was provided. Upon administering the PRN medication, you must follow up with the person to monitor their reaction. Check the person in 1 hour to evaluate if the PRN medication is working as expected. If the person is not responding to the PRN medication, contact the home manager or agency RN for procedural guidance. And always document the results. Medication administration must be safe and effective, however, it should also be stress-free and a pleasant experience for the person. By following all medication administration regulations, guidelines, and best practice will promote a safe process. But what can be done to help ensure medication administration is a pleasant and stress-free process? First of all, medication administration is a personal healthcare support. It should be respected and provided in a private area and confidential. Do not announce or holler out to a person that it is time for their medication. Do not use bells, intercom systems, or other means for getting someone's attention for medication administration. Being considerate during the medication administration process is not only required, but is the right thing to do. All supports must be provided respectfully and with dignity, to include medication administration. Independence is something we all strive to accomplish. As a service provider, supporting and promoting independence is our job responsibility. By encouraging and teaching people supported about their medications and how to administer it, will help them move closer to achieving more independence and personal growth. Each person should participate in their medication administration in some way or another. During the medication administration process, encourage the person to do as much as possible, such as hold the cup of water, get the cup, identify their medications, etc. During the administration process, use the opportunity to teach the person about their medications, to include what it is and why it is prescribed.
Many people we support want to be able to self-administer their own medications. If so, the interdisciplinary team must discuss and evaluate the possibility with the person. Once the team determines the person can move forward, a process for self-administration will begin. Once the person has demonstrated they can safely administer their medications, the individual support plan must address self-administration status.
Congratulations! You have completed the Medication Administration Annual Recertification Course Review. Your time and attention is greatly appreciated. If you have any questions or concerns, please reach out to your supervisor or nurse.